Uh, According to our model, the number of new cases coming every day has already crossed the peak, and we are on the way down. If you look at the number of active cases, that is very close to the peak. Maybe it will peak in next couple of days. So things should improve afterwards.
And what is the margin of error that you are assuming in these projections?
We have about 10% margin of error.
Okay. Also, underreporting, sir, and that's the only other thing that comes to mind, not just because of lack of testing, but also because, some people have come down with mild or moderate symptoms and they've not even reported their cases. They've not even gone to the doctor. Some of the asymptomatic cases. How do you account for the underreporting, genuine underreporting of that?
That's a very good point. And we have a unique feature in our model that allows us to estimate the actual number of cases by simply looking at the data of new infections that are being reported. And through that, what we have found is that while the actual number of cases could be much larger, but the trajectory followed by the total actual cases is very similar to the trajectory followed by the reported cases. So by looking at the trajectory of reported cases, when we say it has peaked, that also implies that the actual cases have also peaked.
Okay, so the trajectory is more or less the same. But Professor, I'm wondering, do you have an indication based on your data inputs of how much worse the actual count could be? We've heard estimates as large as 10 times the official account. Do you think that's realistic?
That's probably realistic, yes. See, as the other anchor pointed out, a large number of cases are really asymptomatic or mildly symptomatic. So probably they don't even realize themselves that they are infected. So that, since that forms a fairly good fraction of infected people, that takes up this factor to a large number. To take an example, in January serosurvey conducted by ICMR in India, this factor was found to be around 30. So it certainly would be about that.
Okay. I'm also curious as to how long you've been modeling these numbers, because other bodies have said that there were warnings going to the government before the real COVID wave here became so severe as it was. And I just wonder whether it's possible the government was ignoring some of these warnings, whether there was an obvious trend earlier on in which they could have responded to more quickly.
Well, we have started modeling this in August last year, and we have been tracking this since then. We also noticed sometime in March that this second wave is coming, and it's getting increasingly bigger. However, in our estimate, which was done at the beginning of April, the second wave intensity was somewhere similar to the first wave intensity. And the location of the peak was towards the end of April. So this is the feedback we gave to the government. And while we got the location or the timing more or less right of the peak, but we didn't get the intensity right. And as I understand that nearly everybody, from what I have seen, nobody could really gauge the intensity of the wave. And it took us all by surprise.